When people think of midwife, they think of home birth, they think of you can't have any pain medication, they think of giving birth in a field somewhere, and really midwifery is so much more than that. Maternal mortality is at a crisis level in the United States. It's in the news almost every day. And it's hard to imagine me even saying that because we know that the United States spends more money on health care than most countries, and still our outcomes for mothers and for infants are not good. We know that midwifery care helps improve outcomes for women. There's lots of research and evidence to say that. There are counties in Arizona that have 0 obstetric providers. Not a doctor, not a midwife, no one. Maybe they have 1. So from a rural standpoint, we know that there is really a tremendous need to increase the number of providers right here in Arizona immediately. The University of Arizona College of Nursing already has a very strong, well-known Doctor of Nursing Practice program. And so what we have done is really added nurse midwifery as a specialty. The nurse midwife is an independent healthcare provider, so they are providing prenatal care, so diagnosis of pregnancy, promoting wellness during the pregnancy, watching constantly for development of problems or complications, helping to manage those, consulting with our physician colleagues if there are complications that develop that we can either co-manage together or may require transfer to physician care. And then outside of prenatal care, the nurse midwife is in attendance and caring for the person during their labor and birth process.
Midwifery, in its essence, the word itself means with women, and we have expanded that to include with all people. The whole purpose of starting a nurse midwifery program here at the University of Arizona is recognizing that our communities really do need this kind of holistic, comprehensive care. What an exciting thing to be able to have a program where you're starting from the beginning. And part of that is listening and saying, how can we best prepare our students to work and serve in these communities. You find people who say, hey, this is my passion, I really want to do this, I really want to serve in my own community. This program specifically is designed to increase the diversity of healthcare providers and especially nurse midwives in the state of Arizona.
We are starting small with great intention, but I really hope for the community of Arizona to hear about midwifery and nurse midwifery and say, that's something I want to do, or I want that type of provider in my healthcare setting, and for everyone to really appreciate what a wonderful profession it can be. When the nurse midwife is an integral part of the healthcare system and team, that's when people really get the best care. I have gotten email after email and phone call to say, we're so happy you're doing this. We're so glad that you're doing this and bringing midwifery to Arizona.
We bring a joy to our work. We bring a humanity to our work. There is actually what we're calling the midwifery model of education, which is we want our students to experience what it means to be fully supported and heard so that they can go out and do that with their patients. When you think about healthcare, it's not just being with women, it really is transforming what healthcare looks like.